Hello, hope you're all doing well. I am going to cover healthcare really briefly. So just kind of a quick overview. We're going to do the last week and a half of school right before finals. And quick reminder, finals are not required. If you're happy with your average test score, it'll replace your final grade, which is worth, or your final exam, which is worth 200 points. So we're going to have 4 different topics. I'm going to try to make these really quick. And we have a 40-point quiz right before finals. That quiz needs to be completed by Sunday, May 10th, I believe. So first chapter of 15 covers healthcare reform. I'm going to do a quick overview of the healthcare reform that's in the U.S., why we need it, and also what our key problems have been, and how healthcare reform has tried or attempted to address some of those issues. So let me share my screen with you briefly. Give me a minute. Hopefully you can see that. Okay, quick overview. So what kind of problems we have in the U.S.? Most of us know what those are and have been. This was prior to us implementing, and they continue to be problems, but these are the primary things we were trying to address, or the government was trying to address with that. We have rising healthcare expenditures. We have a large number of people in the U.S. Who do not have insurance. Maybe they don't have an employer that provides it. They're self-employed. Maybe they're below poverty line. Maybe they're on welfare and they don't have that. There's not an even quality of care. So some people get really good health care depending on where they live, and others don't get that same, especially if you're in a rural area. There's a lot of waste and inefficiency. There's a lot of defects in how we pay for healthcare, and then there are a lot of abusive practices that were out there. Here's kind of a breakdown. We're going to go through 6 major issues. First one being rising healthcare expenditures. As we know, they've risen substantially. Large piece of our gross domestic product, almost 18%. So more than $1 in $6 that's spent on our income is spent on healthcare, so which is a significant amount. Most of you have not had to pay for that yet, and when you get out into the real world and get your first job, you'll be shocked at how much healthcare costs. So hopefully you can stay on your parents' healthcare for a little bit longer, which we'll talk about here in a little bit. This just shows you the U.S. has a major issue. It's comparing, and this is dated, it's more than 10 years old, but it's not far off in giving you the trend. The U.S. has spent a lot more on healthcare compared to other countries that are, progressive countries. Italy is pretty significantly lower. The UK, we're more than double what the cost is for healthcare in those countries, and would say the trend's still the same. So what are those reasons for increased spending? Obviously, there's increased demand. People want new procedures. There's new opportunities. Advances in technology allow people to get things fixed that maybe we didn't decades ago. There's a lot of state mandated benefits. Prescription drugs have gone through the roof. People have to pay a lot of money on that. Higher administrative costs, a lot of oversight. And then there's a lot of defensive medicine. So people are spending more money on different healthcare options because they're available. And there's it says aging of the population is not a major factor, but that could be it. We're spending more to keep people alive longer. Second major problem is that many people don't have health insurance coverage. Prior to Obamacare or Affordable Care Act, over 16% of the population in the U.S. had no health insurance at all. Large number of groups that were uninsured include foreign-born, Hispanics, Blacks, and Asians. Young adults would go without health care prior to the Affordable Care Act, which we'll cover in a minute, how young adults are covered. And then if you were a low-income household, you probably didn't have the ability to pay for health care. You're more worried about a roof over your head and food. So those that are uninsured typically cannot buy it because it's not affordable. And many that are eligible for Medicaid were not, aware that they were even eligible to get that, so they didn't go after it. Third, jumping really quick, what are the consequences of going uninsured? So they'll skip getting treatment, and they'll wait until something becomes a major problem and then have to spend a lot more, have a surgery or something like that instead of doing preventative medicine. They frequently can't pay for it. So when they actually go to the hospital, and most of you have heard that trend where they, if you don't have money, you'll show up at the emergency room because you can't go to the regular doctor. They're going to take care of you, and they know that you're not going to have to pay. They know you don't have the ability, but they can't turn you away. And then basically, they're uninsured will be more likely to die than people, so they have a shorter lifespan. Third major problem: there's uneven quality of medical care in the U.S. Although the quality of care has improved over time, the quality that depends on where you live, type of insurance you have, what disease you're being treated. I do know that young professionals that are going either medical or dental field will get a break on their tuition if they're willing to practice medicine or dentistry in these smaller rural communities, because they can't attract people to go to those cities because there's not the same income flow that they would if they went to a major city. Fourth major problem: a lot of waste and inefficiency. People go out and do a test and then they have a retest. I don't know if that's ever happened to any of you. You're so young, you probably don't have many tests that are out there. They do have errors. I mean, everything has errors, so that happens. They have to retest. If they do unnecessary tests, they're afraid they're going to get a lawsuit, so they wait and don't test. That's kind of what's going on with COVID. People aren't getting tested. They don't want to spend $250 to test somebody and then it'd be a waste. People get in the hospital, they can't find something wrong, you get readmitted, and then you have to be treated again. So every time you're readmitted at the hospital, that causes a problem. Like I said, a lot of people are going to the emergency room for things that are not emergency, so that actually bogs down the whole system. Fifth major problem is, how are we financing or paying for healthcare? The current system actually adds to the problems. So it's based on your ability to pay, not on your health needs. So a lot of people that can pay for it may or may not need the health care, and those that really need it probably can't afford it, and thus they are kind of adding costs to the overhead for everyone, that everyone's going to have to pick up the bill for that. And then when you have a fee-for-service method where it's not like, here's your flat rate you get for health care for the entire year, regardless of how many tests, if you're paying for each fee separately, obviously a doctor is going to ask for some unnecessary tests or treatments. They're going to go ahead and let you pay that bill as long as you're willing to continue to put up money to pay for the testing. Sixth major problem is there are some abuses out there. Insurers, people take advantage. They've either excluded you from, if you had pre-existing conditions, they took away some of the insurance to limit your benefits. They had limits on the most you could claim in your lifetime, which goes away with affordable health care. So all of these things added up. There's obviously a long-term desire to create healthcare reform. It'd been on the table in legislation for years and years. Obama finally in 2010 had moved along, calling it the Affordable Care Act. A lot of people still call it Obamacare. It was challenged, Supreme Court. So it took several years, and this actual Healthcare Reform Act did not go into place until 2014. So it was challenged for a good 4 years. So what does it give Americans? First, it extends coverage to 30 million uninsured Americans. People that previously didn't have health care now would have the ability to have it. They are required to have it. Some challengers of this particular act believe that we're putting an unnecessary financial burden on the entire system. So people that can't afford it are being forced to provide it or show they have proof of insurance. It also forces employers, especially those that pay minimum wage, to require them to have health insurance. So a lot of things what happen is that the employer who's required to provide it to full-time employees will just say, you know what, I'm not going to hire him full-time. I'll hire him as a part-time employee, and I'm not going to provide that because that adds a lot to my bottom line. It does provide a lot of subsidies to uninsured people. So it does, like I said, make some businesses pay for that, but a lot of them will find ways around it. And then it prohibits you from being, for them engaging in any abusive practices. It became effective in 2014. There are a lot of different provisions out there for everyone that's involved, from the patient, families, employers, insurers, and the healthcare providers or doctors themselves. So this was for the individual mandate. This isn't for employers. Beginning in 2014, all U.S. citizens that were legal had to have qualifying insurance or pay a financial penalty. So again, if you couldn't afford it to begin with, and now you're being forced to say you have to have it, and if not, you're going to be penalized for it, it only adds to the problem. It does provide premium tax credits for those employers that provide that coverage, but again, it's still pretty expensive and a lot of employers don't want to provide it. So what were the basic provisions, things that they added to our overall care? What does affordable care or the health care benefits provide? You get your ambulance service, emergency room services, any hospitalization that might occur, helps cover for prenatal, maternity. So when you're actually having a baby, that newborn care, any mental health concerns, those would be covered, your prescription drugs, any rehab services, if you had to have a prosthetic device, any labs. Any of those preventative and wellness things are great, because prior we just talked about how people who didn't have money would just not go to the doctor and they'd wait till it became a big problem and then it was too late. It was more of a reactive treatment. Now that it focuses more on preventative and wellness. Also added a few things for vision and dental care as well. So the new law provides those credits, like I said, to employers. I'm not going to focus on that. Beginning in that year, it showed that, adults with incomes that were in the lower level of income earning, so poverty level, they would be covered and under Medicaid, which Medicaid is for low-income individuals. And we know about Medicare is for people that are eligible for retirement. Medicaid is also a government subsidized program, but it provides health care for people that are low income at the poverty level. And this actually expanded the coverage, so more people would be included. The new law did create a temporary high-risk program. So if you had a pre-existing condition, used to be years ago, if you went from one employer to another and you try to get on the health plan, you would be excluded because you had a pre-existing condition. Maybe you had a heart condition, or you're diabetic, or you had a previous back injury. This prevented you from being scrutinized or discriminated against. So it doesn't matter where if you had a previous condition. It also helped to strengthen community health centers. So just like I mentioned, in rural communities, Jordan Valley Health Center is a community health center here in Springfield. They really tried to enhance that coverage. That health facility hasn't been around for very long. I would say somewhere in the time when Affordable Care Act came around, there's a lot of new investment in those community health centers to provide some low income services for folks. And then they were providing some increased Medicaid payments to primary care physicians. In the past, if you were low income, a lot of doctors wouldn't accept a Medicaid patient. So now they actually expanded it and gave the physicians more incentive to take them on. So back in 2012, after they got it passed, they felt like and projected the Affordable Care Act would cost more than $1.7 trillion over the 10-year period from 2012 to 2022. But they felt like the cost that would be increased would be offset by, so if they forced you to take it on as an employer, they would give you some kind of credit and reduce your penalties for having to pay for it. Not completely accurate, but that's what the intent was. So let's say you had to go out and buy, and this is non-employer type health care coverage. You're self-employed, or maybe your employer doesn't provide health care coverage. You'd have to go out there and find your own individual health care coverage. Go out and buy an individual package, just like you would buy an auto policy. So the individual medical expense program, you go out there for yourself, for your families. These type of things these health plans would cover your medical expenses for going to the doctor, hospitalization. Like I said, those not employed, retired, could be for students, could be for self-employed. It's going to provide the major medical benefits. And I'm going to cover this real quickly, but this is true in all healthcare related, whether it's employer plan or not. You have every year a calendar year deductible. What a deductible is, let's say it's $500. You have to at least spend $500, no different than a deductible you'd have on your auto claim. If you had a $5,000 accident, you'd have to pay the first $500 out of pocket. Same thing with medical program. You would have to pay the first $500 out of your pocket before insurance kicks in. Co-insurance payments. That means, so once you've reached that deductible, and let's say you have a $1,000 expense, they're going to make you pay a certain percentage of that. So you're basically self-insuring part of it. So let's say you have $1,000 and your co-payment is 20%, or your co-insurance is 20%. The insurance will pay 80%. You're responsible for the other 20% that remains. Co-payments, another unique concept, which is, and some of you may be aware that if you've ever gone to the doctor and you have to pay a copay, every time my children go to the doctor under my health plan, they have to pay a $30 copay. So it doesn't matter if they go 20 times a year, they're going to pay $30 every time. Once they've met their deductible, then insurance would kick in. But either way, if they go to the doctor, they're going to have to pay a copayment. And then there's a maximum amount out of pocket. So every plan, after you've spent a lot of money, will have a maximum out of pocket. Maybe it's $5,000. Once you've reached that maximum out of pocket, then you quit paying altogether. You no longer have to pay for co-insurance or anything else. Major medical insurance is what it is. It's covering your outpatient, inpatient in the hospital, any physician, any preventative service, any prescription drugs. Also, like I said, it has that calendar year deductible, and it resets again every year. If you have a family, you're probably going to have an aggregate deductible. So I might mention that maybe your individual deductible is $500. It might be, but your family deductible for the year is $1,000. So even if one family member spent $500, you're still going to continue to rack up some dollars until you reach that maximum deductible for the entire family. Co-insurance I already talked about. Co-payment. Co-payment also applies to drugs. I don't know if you've ever been to the pharmacy, and maybe your co-pay for a prescription might be $10, $5, depending on your family's plan. That's the flat amount you pay no matter what. If you get a generic drug, if it's a name brand drug, sometimes you have to pay more. So like I said, we have that max out of pocket. That's when it stops. You now get 100% of your expenses covered by your insurer once you reach that max out of pocket. Just to keep in mind, there are some exclusions on healthcare, and a lot of those have everything to do with if it's not medically necessary. So if you do a cosmetic surgery, not required, it's more of a beautification or to make you feel better, those do not count. Those are not required services. Also, if you get hurt on the job, we've talked about workers' comp. Expenses that are related to work comp are not covered in healthcare plans. One final concept I'll cover in this chapter, and I'm going to move on, is long-term care. What does that mean? So if you guys won't have to worry about this for decades and decades, but I actually had a long-term care plan. I got it really cheap about 15 years ago. I pay a small fee out of my check, don't even realize it's gone. And basically what that's going to do is if I were to get hurt somewhere along the line, whether at work or on my own, and maybe I had a stroke, I needed to be taken care of in a healthcare facility. We all know nursing homes cost a lot of money. They can break your entire family. Can cost anywhere from $8,000 to $10,000 a month to keep you in a nursing facility. So long-term care, essentially what that means is if you need to be either in a facility or you have to have someone come into your home to care for you, it provides a good portion of those expenses if you pay that premium. Good thing to have. Like I said, a lot of employers provide it, and that's what I did. I bought it through my employer. I'm not going to cover anything other than what are the triggers of getting coverage. Obviously, you have to be impaired in some way. The doctor's going to say it's medically necessary to be taken care of. You can't perform the basic functions of life. Maybe you can't feed yourself or bathe yourself or get up and move around. And so those would require and trigger a long-term care policy. And that's all I have for Chapter 15. I hope talk to you soon over the next topic on employer healthcare benefits in Chapter 16. Talk to you soon.